So Joan, if you wouldn't mind, would you call the roll, please?
Sure thing. We'll start with Emily Mattern,
Here.
Pam Ferguson,
Here.
Louise Frederick,
Here.
Jack Amorine,
Here.
Michelle Frederick,
Here.
Chris Wolverton,
Here.
and I believe that's it.
Okay.
Do you want me to then ask for guests?
Yes, please.
So Rose Ferraro,
Here. It takes me a while to unmute.
George Joseph,
Here.
and Hope Jones.
I'm here.
Hi, Hope.
Hi.
Thanks so much for joining us tonight.
Oh,
all of you.
absolutely.
Yeah. So hopefully you've seen the agenda for the evening. We have a full quorum, so we're ready to move forward. Is there a motion to accept the previous meeting?
So moved.
Thank you, Pam. Is there a second?
Second.
Thank you. Is there further discussion on the motion to approve the minutes of the previous meeting? Hearing none, all in favor, aye.
Aye.
Opposed, same sign. The motion carries. To our guests, welcome. This is the normal opportunity where we open the floor for guest comments. If you'd like to say anything to the Board of Health or to the Commissioner, if you just want to sit back and watch or add your comments later during the meeting, that's acceptable also.
Could I make a comment, please?
Absolutely.
I want you to know how impressed I have been with the Board of Health and the employees with the Kent City Health Department in just dealing with this whole COVID mess. And they are unbelievable, and you should be very proud of them.
Thank you for that comment, Hope. We are very proud of our Health Commissioner and the staff at the Health Department. And quite frankly, I would be absolutely pulling my hair out if we didn't have Joan taking the helm of this ship during this time.
I agree. Joan of Arc.
Thank you. Hopefully no burning at the stake.
No, not yet, babe.
Yeah, the only burning will be to burn virus.
Right? Yeah.
Very good. Well, again, I extend my welcome to all the guests. We're going to go ahead and go through the statistical report for July. You'll find it in your package. Joan, do you have any comments about the report?
No, I do not. I think everything is pretty self-evident. There was nothing that really jumped out at me as a major concern. I think that the items that are down a little bit comparatively to last year is just due to the COVID activity.
Yeah, I would agree, my reading of it. Are there comments for the Commissioner on the statistical report? Hearing none, we'll move on. Joan, your Health Department report?
Okay, so I have a couple of items here. I'll try to make them quick so that we can move on to some other pressing matters. But in terms of a COVID-19 update, our current case count is 105. We do have no deaths to report for the city of Kent. And Rose, please correct me. I'm just going off the Ohio Department of Health website where Portage County has 765 positives and 61 deaths, but I know that count is a little bit off, I think, from what is provided in the morning. That's a little more accurate.
Yeah, because we get cases all through the day, just like you do. So yeah.
Okay. The median age for our group is about 22 years. So we have a very young population that's being affected right now. The epidemiologist from Portage County noted in this morning's call that over the last 24 hours, there's been a 1% increase in cases, and over the last 5 days, also a 1% increase in cases. So that's holding a little bit steadier. In terms of the health advisory that the governor has put on the website, new cases overall are down, deaths are down a bit, hospitalizations down, ICU need for COVID cases also down. But we are meeting in some of the other categories in terms of increased numbers that are in the community, not the congregate care setting. You may have noted if you've gone to the website that there's many more counties in orange that were yellow. Some of the ones that were in red are now back to orange. So that's important. And in terms of our return to school, I think I'm going to actually leave that discussion for later in the agenda. In terms of underserved population, Justin went to see some homeless individuals that live in Kent. There's at least 6 that we know of. He spoke with 3. They referred to themselves as the forgotten people of Kent.
Oh,
And we're very grateful for what we gave to them. We provided them alcohol hand rub, we provided them gaiters, many other resources they get from Kent Social Services. But one thing that Justin asked, what is your greatest need? And they said, we need to have toileting facilities and we need to have some place to wash up. And I think we all kind of take that for granted that we have that in our home, but because of COVID, Kent Parks and Recreation locked down all of their restroom facilities, and many of the portalettes are now locked as well. And so these individuals have literally no place to go. They also accumulate a lot of trash. So one of the restaurant owners has actually told them, just come and bring your trash to our dumpster. We'll accept it, no charge. Just, don't leave it out on the streets or leave it, in other places in public. But we are trying to work to help get them something in terms of helping to keep themselves clean. So we're trying to work something out that way. In terms of testing in long-term care and assisted living facilities, I do have a fairly significant update there. And one of our facilities that had been COVID-free since the start of this event, one healthcare worker tested positive, had actually come into work, had felt fine, passed the screenings, passed the temperature checks, but partway into the shift became symptomatic and was sent home after being tested and returned positive. As a result of that, 31 other individuals were tested, those majority of which were residents, but there were some other healthcare workers that had close contact as well. Thankfully, all of those tests have returned negative. And another healthcare facility that had earlier had a pretty large scale influenza outbreak and had one earlier individual who was a healthcare worker that tested positive, and then unrelated to that had 2 residents that tested positive, was taking place with the Ohio National Guard screening several weeks ago when the governor instituted that. Everyone tested negative, and they had a great turnout for that. They had good engagement with their staff to be tested. They were going through the next step testing, which now is back on the facilities to accomplish their own. And 3 healthcare workers who all were and continue to be asymptomatic tested positive. So as a result of that, 19 more people will be tested by the end of the day tomorrow and sent to the Ohio Department of Health. So that's quite concerning that those individuals were there and working and asymptomatic. Of course, they were all following all the precautions and wearing their PPE, but still a concern. So that was assigned an outbreak number from the Ohio Department of Health. So I will be following up on that. We continue to do food service operations inspections throughout the city of Kent and continue again to reinforce the COVID-19 education. Compliance checks for the bars and restaurants have gotten a little bit easier, at least time-wise, since the governor instituted the 10 p.m. last call and 11 p.m. last consumption on site, and then there is carry out till their standard closing time. But the DORA is now open as well, and I've heard from Chief Scheer that there have been no problems with the DORA. It seems like it's pretty well in hand, but it is certainly these changes with the last call and the last consumption on site has definitely decreased some of the activity in downtown Kent, which is good in terms of the large groups that we're gathering. But I know it's another economic hit to these businesses that were already struggling. And so that economic concern is still ongoing. We did institute a citywide Safer Businesses plan, and that entails a business pledging to comply with 5 different practices that are established in terms of evidence-based practice for safety during COVID. And then once they sign the pledge and they're screened and found to be indeed compliant, Mike will put those on the website, and he's been vetting those businesses recently. Have you had a chance, Mike, to get out to those yet, or?
We went to one business today.
Okay.
The other ones I'm going to try to go to.
Okay.
the week.
Okay, so we'll try to get those up, and then hopefully others will see that on the website and they'll want to participate as well. We did have an update in terms of our move to PARTA. Our cabling is done, our electrical is in, and we were told initially September 8th would be our final date here at the health department at the current location, but I'm going to try to push that up to before Labor Day. Gary was saying that September 8th would be the day that we would finally be up and running. And I said, we can only be down for one day. We cannot have a weeks long or 2 weeks long period of inactivity at this point in the game. So he's working as diligently and hard as he can on this. And I know it's stretching the resources quite a bit to get this done, but we will be moving. I did go to the Architectural Review Board and they passed our sign, which was another hurdle that we had to get. We have to be able to have people find us where we'll be at the second floor in the PARTA building. So that was approved, but I do have to go from the Architectural Review Board to Planning and Zoning, and that'll be on the 18th. In the meantime, we found out that the Kent State School of Music will be moving to our space because as they try to decrease the density of classes on campus, they found this space to be worthwhile and accommodating for them. So we need to exit this space so that they can then come and fill it. In terms of the EPA mosquito grant, the Ohio Department of Health notified us that we had sent 6 samples down from pools in Kent, and they were planning to send those 6 samples to the Centers for Disease Control for testing. Unfortunately, they lost all 6 samples.
Oh, gosh.
Which I find was very disheartening, and I felt bad for the interns who'd worked really hard. So that will just be logged as not tested. And we won't know if there is West Nile here from those pools, but we could do more sampling. The interns are also adjusting their schedule so that there will be no overtime this year. Last year, there was $2,000 worth of overtime, and the board graciously agreed to make that accommodation. This year, we're just keeping a little bit closer tabs on our time and accommodating to make sure we don't go over. In terms of the 4th item with the food service organizations, I already spoke to the first one. With the governor changing the last call, Justin did complete his first Serve Safe class since COVID-19. He had 50 inquiries for the class, but it ended up only 7 coming in person. So it was a little bit lower turnout, and I think it was just hard. There were several restaurants that had low staffing and were not able to send their people. In terms of the housing inspections, we did implement these safety practices. Unfortunately, they're not 100% effective in terms of sometimes they'll go to the door, knock on it. Once they're in the apartment, the renter will say, oh, I'm COVID positive. You can't be in this space. So, you know, it's a little bit disheartening because messaging did go out. I mean, before these appointments are made, that was a big step that we instituted, is that there had to be notice and that we asked people to vacate the premises if they could during that time period, or at least post a sign or note on the door stating that they could not have an inspection at this time and we could reschedule for that unit. So it's been a little disheartening, but we're continuing to make progress there. We did have a few housing owners that actually called our health department and said, hey, we've caught wind that our renters are asking us to extend their lease because they're on quarantine. Is this true? So they've actually notified us of positive cases that then when we looked in ODRS, they had given their permanent address, not their current address. And so we were not aware of them. So that's worked out in a couple of situations. And that's the end of my health department report.
Thank you, Joan. Are there questions for Joan on the health department report? Hearing none, we'll move on. Rose, would you please give us the nursing and FEP reports?
Sure. Okay, so I sent my report in, basically just highlighting our COVID cases. We are still working with Ohio Department of Health because we like their system that they're using, and it's all HIPAA compliant, so we can continue on our having that go with our people that we are contact tracers that we are hiring, and also using ODH. So it's working out very well. We're still continuing to hire more contact tracers because as we go through, we know with schools, we're going to have an increase in cases. For the pop-up testing, just to let you guys know, we did 2,121 testing. It was very nice. It was really nice to see Joan and everybody out there from Kent City to see how everything went. It was very hot. But it was actually a lot of, I enjoyed it. It was fun. So, but I was only out there 2 days. So, but at this point, I don't think we're going to have another one because we've got flu coming up. We got back to school shots, and then we're going to have probably COVID. So if we do anything, it would probably be after the flu season. So at right now, saying that, we've gotten our notice that we are getting our private purchase flu in probably in sometime in September. So excuse me, I'm not sure about Ohio Department of Health when we're going to be getting their flu in. So we did get the nasal. We ordered it, I should say. I haven't received it. So we're hoping this year we're not too late and we get some of that. So what we were thinking for our back to school clinics, because that's what I'm focusing on first. At first, I thought I would get the trailer and maybe house it so that we can have an open flu clinic. But the more we thought about it, we're not going to do that. So what we're going to do is have multiple days and multiple times. So it looks like right now we're going for maybe August the 26th. I'm doing, and we'll send this out to you once we get it, because I want to get some time for Kent City too. Having 2 flu clinics that day and then going on Thursday. So like doing it Wednesday and Thursday for a few weeks. We're still going to have to make the appointments, get their information and have them come in that way. It's the only way that we can do it. We're safe and everybody else is safe. And then we don't have to lug all those vaccines. So I will get with Joan and we'll try and do something for Kent also. We can work on that. The flu clinics, we are looking at drive-throughs. There's no other way I can have a flu clinic and not have a drive-through. It's easy. It's not as time consuming as the school clinics are, because we have to look everybody up on either HCIS or Impact SIS for the schools. So that's what we're looking at right now. So we're hoping that works. We're taking one day at a time. We are also want to increase our clinics. We don't know how, but we're also scared because of the fact with the schools reopening, we're not sure what that's going to look like. Last year we went into the schools. We're not going to be able to do that this year because of safety reasons. We want to increase also on our children with medical handicaps. You know, we're getting a lot of calls for hearing aids and different things because with school starting, they want to make sure that these are done. So we're still having our staff work on that. Let's see if there's anything else. We have with our new nurse, Mamie Sawyer Bauer, who came from Canada. She's got 17 years public health experience. So she actually came at a good time. We've not even trained her and she's already running with COVID because that's all she did in Canada. So our immunizations are a little bit different. It's not that they're different, it's the different schedule. They had a different schedule in Canada. Here we have private purchase vaccine, state vaccine, and indigent vaccine, where in Canada, it was just one vaccine, you just gave it, it didn't make a difference where. So we just have to do her some training on that. What she is doing, which we're really happy. So we're looking at the hepatitis B and hepatitis C. We automatically do hepatitis A as far as, calling them and making sure that. So we've never done anything with hepatitis B and hepatitis C. So we're actually sending letters out now to the parents or to the people who are cases, either chronic or, oh God, I can't even think. But anyway, we're sending information out to these cases. So what we're finding out is they're not even notified by their doctor that they have the hepatitis. So we thought, well, we're going to wait like a week before we go ahead and email them a letter. ODH used to have little booklets like on hepatitis C, hepatitis B, acute, chronic. I have to find if they still have that because we don't have any books. So we want to still maintain that and continue that education for those people. So we've gotten several calls back so that they were happy that we sent that information. The other thing we're going to look at is STIs, trying to figure out how we can get some more demographic information, make sure that they're tested, make sure that we have everything that's correct in ODRS. That will help us with some of our statistics that our EPI wants. As you can see at the end of the page, at the end of the report, it has Penny's information. The communicable disease is on there. We're not seeing a whole lot of anything other than COVID right now. And that's basically what we're seeing. But on the very back of it, this guidance for our contact tracing, this is our education that we provided for all of our contacts that we, through the state and also the ones that we have hired. So we actually have them go through a series of training before we actually give them cases to work on. Because we want to make sure that when they are ready to start, we're good to go. They know what they have to do. They know where to go to get information. And this is actually the system that the ODH has that we have. Any questions?
So Rose, I'm looking at the communicable disease report
Mhm.
and you know how crazy my mind works.
I know.
The fact that I'm seeing chlamydia tells me we're not doing so really good job at physical distancing.
This is true. And if you look the line below it, we're definitely not doing physical distancing.
Right. So do you think this is an opportunity for us to do some more health education to get people to really start thinking that physical distancing literally means physical distancing and not just covering your face?
Good luck. I would love to see that. So that's some of the thing that we're trying to do is we want to make sure. And I know, when we had Angela under ours, we would contact the doctor, make sure they were treated, and just let them know that they need to contact their sexual partners. Just to give them. But we don't get calls back. We don't even get calls back from the physicians on other things that we have that are very, not that this isn't important, but more critical.
Right.
So we're going to try it. I've been there 18 years. We used to do it, but we were not successful at it because a lot of the people don't want to call you back. And then when we would send letters out, if it was a spouse of somebody, because we don't know if they're married, we don't get that information. And how many times have I gotten called that it was a spouse that opened their letter because it was marked confidential. And then, you're backtracking to what you're saying, there's nothing I can do,
Yeah.
But we thought we're looking at something we can do with that information. We want to see what we can do and how we can get it and get some of our our EPIs really like, we got to do this. And she understands it on an EPI part. I don't think she understands it on a nursing part. It's not going to happen. These kids are young. They're not going to call you back, so, but we're going to try it. That's all we can do is try. Maybe it'll be successful this time. So hopefully.
Yeah. I'm still going to use that as a surrogate marker for physical distancing.
Yeah, and also too, to let you know, ODH is collecting the data for pregnant residents on the COVID. So we've actually had a few of those. So, and actually both of them have delivered. So I think ODH did reach out to them. All you have to do is provide their information of their provider, and then they will go ahead and reach out. So do you guys have any questions or concerns?
Any other
Hello.
questions for Rose?
I'll just say hello.
Oh, hey, Angela, how are you?
Good. Sorry to be running late.
Oh, that's good. Did you hear your name?
Yeah, but what were you saying about me? I hope it was all good.
It was good. It was, remember the STIs? When I had to call all the doctors and get the information, and was like horrible. They never called back.
Yeah.
So we're going to try it again.
Good luck.
She said
I guess
enthusiastically.
I know.
You're going to call the physicians to get the info, and then you'll notify the patient.
Yeah, and it's not necessarily, we're not going to track their partners. We're just going to track to see if they were treated, give them education on sexual behavior and stuff like that. So we'll probably be reaching out to you guys too. And which is good, is because we are getting that information now, which before we didn't get. So at least we're getting that they are treated, which I'm really happy about.
Great.
So Rose, I did have one other thing.
Sure.
I'm looking at the new color-coded COVID map.
Yeah.
And I was just wondering if you had any insight as to why just east of us and in the north corner of the county, we're seeing the higher number of cases.
You know what? I don't know, but we've actually, that is just amazing. A lot of our travelers too are coming from that area. And I don't know why. I don't know if it's because they're testing more. I have not a clue. It just seems like it's so random everywhere. To do this, it's just mind boggling, because it's like they're just all over. Even today when we're calling some of our contacts, because we do on our cases, we call everybody and all their contacts are listed in ODRS. Not only do we call all of our patients and we follow them daily, we follow all of the contacts through OCTS. So everything is marked so that way it can tell us if, she's still not feeling good by their comments when they're saying yes, no on those things. So then we're calling the patient saying, what's going on? Do we need to extend you? So we've actually extended quite a few people, because what we have been finding is the people in the age group of like 25 to 45, their being fatigue is really lasting a long time. And the headaches are about 3 to 4 days continuous with no relief. So we are finding that as we go through, but I can't tell you why it's like that. It's just amazing, because I know it's like every time we see something, it's that count, it's that area, and I'm like, wow, what are these people doing? But so I don't know if they're getting tested more, and I don't know.
Would those be related in any way to congregate care settings where they're maybe having, at least initially? No? Okay.
No, because we keep those separate, just like as you said, because with the testing, we have to report that to ODH every Tuesday. So all of our congregate care, whether it's an employee or a resident, we have to report that. So we follow those separately.
So this zip code map would only be community members, non-congregate and
No,
non-congregate?
it would include the congregate. It would include the congregate employees. It would probably include everybody. It has to include everybody.
That's what I would think, but yeah,
Yes,
okay.
it have to include everybody.
Okay.
So we haven't had any congregate care
I don't
residents for a while. We do have employees, and we're going to see that because of with them testing every 2 weeks now, we're going to see it more and more now.
Any other questions for Rose?
I have a question. Hi,
Hi.
I was just curious, out of the cases that you've seen lately and with all the contact tracing with the symptoms, what kind of percentage of the cases are still showing fevers?
It really depends on the age group, and we're actually noticing that fevers are not one that we see a lot of. If they have a fever, it's a fever for like maybe a day, and then it's all the other symptoms. But however, it seems like the older the person is, the fevers are much higher. But then they
Okay.
also have other comorbidity of other signs and symptoms of other things going on.
Okay, I was just curious because it does seem that still a large majority of the public believes that, you know, you have to have a fever to have any concerns about COVID. You know, I've been working an after hours answering service for the last few weeks just to help out with physician's office after hours. And it's all COVID calls now. And, you know, nobody has a fever. So they don't think that they have symptoms otherwise. And they think they just have allergies, which sometimes that is the case too. But, you know, I guess I'm kind of curious as far as, you know, students coming back to campus and public schools starting, what kind of other education we can provide, again, to really, you know, be sure that people are aware that you don't have to have a fever at all the whole time, and you can still have it and be symptomatic and have, you know, be contagious.
Right. So if you really, when we interview these people that are positive, residents that are positive, we really try and go back and say, okay, like, tell me what you have like a few days ago, because sometimes they'll say, oh, I just had a fever one day, or I had a fever and I took Tylenol and it went away. And they're not really listening to their body as much as we think they are, because they want that high fever, they want that 100.4, they want the 100, you know. And I tell them, listen to your body and go. When we go back, we can see they had little symptoms as they started progressing, and then it could have been nothing. They could have been, that was it, they were done. But some of them don't, and some of them do.
But
And
that's
that's
what I'm finding, yeah, with the younger group that we're now seeing and the contact tracing that I'm doing, their hallmarks seem to be headache, fatigue, and then the olfactory, the loss of smell and taste. That seems to be the big three that and none of them are saying fever. It's very rare.
very rare.
I would say under 10% and maybe even lower than that. And of those that have fever, they tend to be the olders in the 30s, 40s, and 50s. Not
Right.
still very young, but in terms of, yeah.
It is. And when we ask about the headache, because that's like a hallmark on them, they say it's like 3 days and nothing helps. I mean, to the point that they're laying down. It's almost like they get a migraine. I mean, I never had a migraine, so I don't know, but I'm just assuming. They said that no matter what they take, they could take Tylenol, Motrin, whatever, nothing relieves the pain on the headache.
Other questions for Rose? No. Thank you so much for coming, Rose, and joining us and
Thank
providing the
you.
report.
Okay, bye-bye.
Bye. Take care. Okay, so Joan, did you have anything local that you wanted to add to the communicable disease reports that you didn't already cover with the COVID?
No, I don't believe so. I mean, we do continue to see some STIs. We have had some random, like we had a Giardia case that came this week. So there's still those typical things or atypical things that seem normal now. But yeah, certainly not in the degree that we were seeing prior.
Okay, good. Thanks for that. We're going to move on to the discussion items for the evening. And we want to thank the superintendent for being here to share with us what's going on in the Kent City schools. But that's the first discussion item, is thinking through what are the indicators that might want us to consider advising the health commissioner and her advising the superintendent on what indicators are necessary for considering school closure, and what indicators are really not being of a much value as we're learning, like the fever issue with younger aged individuals. So Joan, you want to lead us off on that?
Well, I think that there's been a lot of, community hankering for information. They want to know what is the plan for the schools. They're concerned about the options. They're concerned about in-person, but they're also concerned about socialization and ability to learn at home. So I know that I've had quite a few emails and phone calls from parents that have actually asked me to close the schools for the first 9 weeks. And that's one of the reasons that I asked Hope Jones, our legal counsel, to come and kind of share what is the authority of not only myself, but the board. I know in terms of isolation and quarantine, our board has the right to institute that so that if somebody is posing a threat to the public well-being, that the board can impose a quarantine or an isolation. If we don't have a quorum, I can do that in the board's stead. But and the same thing goes for food service organizations, because we license those. We can pull the license. The board can say, this is an unsafe practice, it's critical, pull the license. But with the school, it's a little bit different. We do some licensing in the schools. We do school inspections, but I just wanted to get some clarification on terms of the realm of our authority so that we, in case the situation arises, and it may, what would be our boundaries and how would we safely function? So Hope, would you be able to provide a little background on that or weigh in on that?
Yes, I would. And I understand everyone's concerns, but honestly, at this point, I don't think it's time for the board or the health commissioner to make decisions for the schools. The governor has authorized each school system to make their own decisions. As far as I know, the Board of Health, the State Board of Health has not made any overarching orders for schools. And honestly, at this point, when I look at the revised code and what the governor's doing, what the Ohio Department of Health is doing, I am not comfortable with Joan or the board making any decisions regarding the schools. Now, that being said, depending on what happens, we're all waiting for the second wave. We're all, wondering what's going to happen. My opinion may change, but at this point, I think it's up to the school superintendent and the school board to make the decision as to how they want to educate their students.
So, Mr. Joseph, would you be able to discuss with us just briefly? I know it's been weeks and months in the making for your plan for how to return to school. Could you just share with the board some of the barriers, the challenges, and the concerns for how you developed your plan and what you're looking at in terms of? I know that there's safety risk levels. I'd rather have you explain it than me try to.
Thanks, Joan. And before I do, I wanted to say hi to Dr. DeJulius. Thank you for showing up, and I know you have patience. And I wanted to also, since I have a moment, just thank the board for allowing me to attend tonight and to talk with you. As most of you know, Kent City Schools is the largest school district in Portage County. And we really look to all of you to give us guidance, because we are not medical professionals, nor do we pretend to be. And again, I just have to say, I know that we started the meeting with all of you appreciating Joan, but you have no idea how much I appreciate Joan, especially over the weekend. It's been really kind of an interesting thing. And I was interrupting her jogging or running or walking. And Joan, I'm sorry, but again, you were just a lifesaver in that you were available to us as a school district. So I'm going to go ahead and point out, if you're not aware, what our plan is. again, using all of the information that we were provided by the American Academy of Pediatrics, the Ohio Department of Education, the ODH, and Joe Diorio and Portage Health District, and Joan and all of you. We spent the majority of the summer really trying to come up with a plan. On July 6th, it was right after the 4th of July weekend, I gave a second broadcast to our parents because I felt like they needed to know what we were thinking. And so I shared on July 6th with our parents in a huge broadcast to all of them that we were thinking about a blended model. Wasn't very specific about what that would look like, but a blended model possibly, and at the time it was possibly 2 days in school and 3 days online as an option. And then as a second option, having a full online for those that choose to do completely online. And I thought I was doing the right thing by sharing that when I did. And a lot of our parents thought that was the plan. So again, I tried to make it as clear as I could that this is what our thinking is right now, but nothing has been decided, nothing's in stone. But people took it that that was our plan. So later on in July, when I was trying to finalize our plan, again, I was trying to keep it flexible, and we attached it to the governor's color-coded risk factors. And I, again, using the information that I had at the time, we used that, and I put out there pretty much and had it board approved as yellow and orange. We would go back 5 days, and then possibly if, and a disclaimer in there saying that if with Joan's help as commissioner for the Kent Health Department, we decided differently that we had the right to make a different decision, even regardless of the color. And what was different with our plan was that we not only included the colors of what Portage would be, but the coloring of the the surrounding counties, with the exception of Cuyahoga County, because it's sort of an outlier and densely populated. So I think, and from what I've been told from my colleagues, we're the only school district that even included surrounding counties. So that was what was different with our plan than with other school districts. But this was the thinking. We are so closely, as a school district, we are so closely connected to our 6-district compact, which again, we're one of 6 districts, but we're the only district from Portage County. All of the other ones are in Summit County. Our open enrollment comes from other counties, and our teachers live in other counties, and they're the ones teaching our kids. So how can we ignore the color of our surrounding counties and just do Portage? So that's what our thinking, that's what our logic was in including that. So with that, I just last week pulled the idea of a 5-day because we just really tried our best to figure out how we can do 3 to 6 feet, and with 6 feet as the goal of social distancing with all of the kids back. And because we're the largest school district in the county, we have over 3,000 students, in fact, 3,300 students. It was really difficult after measuring classrooms and trying to figure that out. So I made the announcement that I was pulling the 5-day, and that if we were yellow, orange, or possibly red, and again, with a disclaimer that we can change regardless of the color coding on what's safe, that we would do the blended learning. And if we were purple, we would do all online. So that's kind of where we are at this point. So let me just go back to my notes here. If Portage County and surrounding districts are yellow, orange, red, a blended learning plan of 2 days in person on Tuesday, Thursday, or Wednesday, Friday will be followed. Half of the students will attend at one time, and all students will have 3 days of online or at-home learning. And since that time, we did survey our parents, because in the survey, they had to select cohort A, which is Tuesday, Thursday, or cohort B, which was Wednesday, Friday. And that was a challenge too, because we knew that it's not going to divide up nice and even, but we wanted to give our parents the choice. And again, the other choice is full online. And so they actually had 3 choices: a Tuesday, Thursday blended, a Wednesday, Friday blended, or a completely online. Okay, so once we put the surveys out, very quickly, we found out that kids were telling their parents, we want Tuesday, Thursday, because it would give us a 4-day weekend. So, and of course, that's not going to happen, okay? They're going to be working very hard, blended or online, on those days that they're not in school. They just don't know it yet, okay? So very quickly, we learned that. And so I put out a message to all of our cohort A parents and said in a broadcast and an email, I know that we gave you a choice and we anticipated that this could happen, but we could have just gone by last name alphabetically and not given you a choice, but we decided to give you a choice, but we need your help. And this is the situation. And I shared that with them, and I had 81 parents switch their choice from cohort A to cohort B, which was Tuesday, Thursday to Wednesday, Friday. And we were able to pretty much with, and again, preliminary numbers, very much so balance out all 3 of those areas. So we have about 1/3 of our parents that selected online, and it's full online. We have about 1/3 of our parents that selected Wednesday, Friday, and the final 1/3 that are now in Tuesday, Thursday. So my comment to all of you is that 2/3 of our parents have selected the 2 days in with 3 days online, and only 1/3 selected the full online. And that if we were forced or asked to go to full online, 2/3 of our parents will not get what they wanted, and that's for sure. So that's a challenge. But again, I was all set to, in fact, my original thought was that as soon as we provided the online full option, half the parents will choose that. Well, it didn't work out that way. I really thought, honestly, the end of June, beginning of July, I thought as soon as we put that out there, half the parents will, at least half, if not more, would choose online. And only 1/3 did. And that's kind of where we are right now. And to be honest with you, and please don't hold me to these numbers. Please, I'm just going to give you some numbers to show you how close they are. Cohort A which again is Tuesday, Thursday, 2 days in on Tuesday, Thursday, and 3 days out with online. We have currently, as of today at 6 o'clock, we have 1,094 students. Okay, for cohort B, which is Wednesday, Friday, and that's 2 days in, 3 days out with online, we have 949 students. With cohort C, which is the fully online, we have 964. We have a cohort D as well, and that is our special needs students who are moderate to intensive that need to come in for more than 2 days. It could be 4 days, it could be 5 days. But again, they're working in small group or one-on-one doing, OT, PT, that type of thing, getting the services they need for their IEP. We have right now, just at Roosevelt, 15 signed up, but I don't have the other numbers just yet. So as you can see, the breakdown is luckily, and again, our parents are great. Who would ever guess that me pleading with them that we need help, and we would get 81 of about 160, 1,164 who chose A originally. 81 of them made the choice to go to the other cohort. So that's impressive to me, just by me asking. So comments.
Superintendent Joseph, I was wondering, because some other districts have decided to either delay school start by 2 weeks or go for all online for the first 9 weeks to just kind of give everybody an ease into the school start. What are your thoughts about either delaying by 2 weeks or going all virtual for the first 9? And I think you may have addressed that based on 2/3 of the families wanting some form of in-person, but could you just talk about those other options a little bit that we're starting to hear about in the news?
Well, and again, it's interesting because my colleagues in Central Ohio, that's where I came from. My colleagues immediately reached out to me when Franklin County put out there that they need to start the first 9 weeks. They said, well, what are you doing in Kent? Well, I said, Kent's not the same as Franklin County. We're Portage County. And I was very little help to them. But again, the concern that our concern right along in Portage County, especially here in Kent, and I would say even more so in Ravenna, because I talked to Dennis Honkla about this as well. Many of our families, they wouldn't eat unless they come to school. And we're talking, like I said, in Kent, it's high enough, but in Ravenna, it's even higher. We almost have to have kids coming in to get the food so they could take that food home. And we're talking breakfast and lunch. And in many circumstances, that's all they get all day. They don't even get dinner. So that was weighing on our minds all summer long. As all of you, I hope all of you realize that when we were out of school for 55 plus days in the spring, we were delivering food to locations and kids were not hungry. They were eating. And we made sure of that. We had a great program through what we were doing out of Stanton Middle School's kitchen. Again, using Aramark and volunteers and the Ben Curtis Family Foundation and Kent Social Services. We really wrapped our arms around that and provided that. So again, if you just stop and think about that, if we did even a 4-week or a 2-week phase, and that's time that a big chunk, a huge majority of our students would not have the ability to eat. And that's a concern. So that's why first of all, that's why we gave parents choice. We gave them choice because they really deserve to make that choice, have that choice and to make that call. They know their kids best. And so that's why we all along gave the online full option. And we learned a lot from last spring when we were thrown into that. It's going to be more robust. We've purchased things to make it better. Our teachers are being trained to do this instead of being told, hey, you got to do it in a week. It's going to be, no matter what choice they make, they will be pleased. And I really feel that. And I truly believe that with our model, the blended model, having 3 cohorts, the online completely, which is cohort C, the Wednesday, Friday, which is cohort B, and the Tuesday, Thursday, cohort A, we can divide kids up. And, you know, if you just use 25 in a classroom as a guide and you divide it by 3, okay, 8 of those kids are going to be online. And then you're going to have 8 or 9 kids in a class 2 days a week. We can do 6 feet between kids with masks in the classroom. Now, what's going against us is our elementary classrooms are a little smaller than what we have at the high school or at the middle school, and we don't have air conditioning. That makes it a little more difficult when you're wearing a mask and it's 90 degrees in there. But I think, you know, if it's 9 degrees outside, we can go outside. And like it was mentioned several times, you know, we're going to take advantage of the nice weather that we have while it lasts and use that to our benefit. So, Joan, does that answer your question?
Yes, the other question that I had revolved around, we've been doing a lot of work with Kent State University and identifying what their plans will be. One thing they ask us is, what does an outbreak consist of? And right now, the current definition is 2 individuals. So if you have somebody at Stanton Middle School and the high school that are maybe brothers and sisters, and they each get COVID, you could technically have an outbreak. If you have 2 people at any one location, you could technically have an outbreak, and it doesn't take much for that to happen. So I know that that's a big concern that I have heard parents asking, what happens if one person in the classroom becomes ill? Does the whole classroom have to go on quarantine or isolation? And again, that's dependent on how close they are for what period of time. But that is concerning to me, that for the in-person option, that we could quickly reach numbers that would make it very difficult for you to hold those in-person classes if there is an outbreak that's more than 2 people. So I'm not sure what the plan is in that case. That you would just go online then?
Yeah, our plan is at any given time, if we need to go completely online, then we go online. It is actually more difficult to plan for the blended than it would be for the online. It's more difficult. So, you know, we're not, we're taking the tough road to make this work. And again, our teachers, the training that we have set up is we're going to be looking at blended because it's the tougher way to go. And if we need to go online, it's not going to be as tough, because again, they're planning for online and in person at the same time. When we have other teachers, oh, maybe I didn't tell you that. our goal is, sorry, our goal is to have different teachers teaching the full online compared to the blended model. So we're not expecting a teacher who is going to do face-to-face 2 days a week and 3 days online to also do the full online with kids as well. They are completely separate individuals, and we're staffing at that.
George, can I ask a question, please?
Mhm.
George, may I ask a question?
Yes.
Okay, I'm sorry. This is Pam. I keep getting kicked off the computer, so I'm now on my phone. So I'm sorry that I'm bouncing around on everybody's screen, but thank you, Mike, for bringing me in 2 times. But anyhow, my question is, because I was kicked off twice, I missed the numbers for cohort A and B. Would you mind giving those to me again, please?
Well, Pam, you're going to get them again next week, but I will give you these again. And they might be, again, these are preliminary. We still don't have all the numbers counted. But for cohort A, we have 1,094.
Okay.
For cohort B, we have 949. And for cohort C, we have 964.
Great.
And for cohort D, which is special needs and,
Right.
okay, we have 15, but there's going to be more than 15. And they're
Right.
going to be coming out of the cohort A and the cohort B.
Got it. Okay. Thank you for that. I was doing the math in my head and I figured A and B were close to that because I caught C and D, but I just wanted to make sure. Okay. I'll wait for the updated numbers next week also. Thank
Okay.
you though.
And if you want to do the complete math, let me give you the total so far. Total count is 3,022 students. 3,022. And that's not all of them, but it's the majority of them.
I think another concern is that if we would have to move from the hybrid model to all online, that might need to happen so quickly. I have a lot of concerns for parents who are struggling for care for their children. If that happens rapidly, that they won't have arrangements, especially some essential workers aren't given the flexibility of their schedule because they have demands on them that they must be at work. That how would that be addressed?
That's a great question, Joan.
It's a tough one. It's a tough one.
That's the $1 million question. And again, I can't begin to tell you how many parents I personally talked to over the last 2.5 weeks. And that's exactly the scenario. You know, someone works in an ER somewhere, someone works at the Cleveland Clinic, and they are essential workers. How do they handle that? I don't have an answer for that. And my hope would be that if we make the change, that our original thought was we would just change Thursday when Governor DeWine changes the color chart, and that gives us Thursday night and Friday communicate with parents. Well, that's not going to help parents for a Tuesday or Monday start for the next week. Maybe I think the longer we could give them, the better. But again, we're talking COVID-19. I mean, we can't have people having an outbreak over it. So I don't know. That's a great question.
That's my concern, is that 3 or 4 weeks in, especially if sporting activity is not altered in any way, that we will start to see increased cases, and that then parents who originally maybe spoke out in favor of a 9-week all virtual will say, oh, you had the opportunity to do this early on. How come we couldn't see this outbreak coming? Or that parents will be angry when there are cases in the school because they will have thought, I thought this was going to be safe. You know, there was a plan in place that they maybe don't understand that nothing is risk-free at this point in time because we don't have a vaccine. So there's nothing really risk-free. So I'm not sure. And I don't know that there's an answer to that, but I have those concerns that parents may come back and say there was an opportunity missed here by not delaying the school or going online, at least initially.
Joan, I would like to really recognize the superintendent and his leadership team because, you know, the same as, you know, with the health department crew, this information has been coming fast and furious from ODH and just from all types of sources. So, you know, the district has been trying to communicate consistently as these plans have been developed and improved and approved. But that certainly is a strong possibility. And I really just don't know that there's anything we can do to avoid that. There's always going to be people that are going to be unhappy, and hindsight's 2020. I mean, I hate to use that example, but it's going to be difficult. There are going to be those that are not going to be happy with what we do as a district, no matter what we do. So, you know, we're making the best decisions as we can with the information that, you know, we learn from the health department and the state and everything else. So I don't know. I mean, I think we have our seatbelts on.
Right, yeah. And I know just like with the restaurants and the bars, what we're seeing is that they can institute the strictest guidelines and follow things, but it's the after hours activity that gets them into trouble because the cases are discovered and linked because of a common area, a particular bar or restaurant, but the transmission isn't happening there. It's happening after hours because then the standards are not followed. And I think that that's a concern that maybe parents might not realize, that the case may be identified in the school system, but that transmission happened on the Saturday weekend when everyone got together for the birthday party or the backyard barbecue and not realize it was not a school transmission. It was because of other activities that were not safely monitored or attended to.
Joan, that's an extremely important point for us all to realize. You know, if you think about even a 1% background transmission rate, that's one person out of 100 that will be infectious, that will come down with COVID, regardless of the symptom. So I think it's important to be upfront with parents as well as the community that we have to admit that there will be cases. It's what we do about them that's important. And I think that the superintendent has outlined a really nice plan to kind of mitigate midstream. But one of the things that I didn't hear that I would love to hear, Superintendent Joseph, is what are your thresholds and your triggers? So for example, knowing that there will be cases, are you anticipating, as Joan pointed out earlier, 2 related cases closes the school? Does it close the district? Right? What are the triggers that you're looking for to be able to say when you exercise the specific parts of your plan?
I thought I was muted. I guess I'm not. You know, that's again a great question. Now, maybe I should preface this that this is I've been in education 40 years. Never did I have to deal with any kind of anything like this. Never a school start like this. So it doesn't matter that I've been in education 40 years. I've never experienced this. Right. So what I'm saying to you is, in my mind, I'm thinking one thing, but reality might be completely different. So my hope is that we won't get more than 1 at any given building. My expectation is we're probably going to get 1 in every building, and that's if we're lucky that we'll just get 1. And I just hope that it's not something that, you know, again, if Joan, I didn't know the number 2. I didn't know what that number was until just tonight. that makes me really nervous. But again, all of this is new territory for all of us. And the number, if you asked my opinion about what's the number one concern for me, my number one concern is not so much starting school the way we have it planned, but then on September 7th, we have Labor Day. And you know what happened after the 4th of July, and you know what happened after Memorial Day. Well, you think that something's going to happen after Labor Day? And you know, people put on a great facade saying, yep, we're following this and following that, but they still go to relatives' homes, they go to pool parties, they go to graduation parties, they act like there's no threat out there in this battle of COVID-19. So my biggest concern is that, hey, we'll get started wonderfully. And then 2 weeks later, we're going to have Labor Day hit, and whatever parents, you know, they might feel a little more relaxed with grandma and grandpa coming over, and it's been a long time. They haven't seen them since Christmas. You know, I'm worried about that. The other thing I'm worried about is whenever we have any kind of 3-day weekend or holiday, our staff, if they go to, let's say, one of the states that's, you know, having some issues right now, they should be quarantining themselves. And will they let us know that? Our parents, they might go somewhere on a trip. Will they let us know that? That's where I'm not sleeping at night, thinking about what the possibilities would be.
I don't mean to give you any more headaches, but our current rate of transmission in Portage County is 4.6%. So for every 100 people, 5 will be positive. So it can extrapolate that out through 3,300 students, the number of people who may get sick. I think it will be more than 1 per building.
And that's the reason
Question
for,
too. Oops, sorry, Chris.
that's okay. And that's the reason for asking what type of triggers, so that you're poised to make a decision and not having to knee-jerk react when you find those 5 that are related, as opposed to saying, well, when those 5 show up, we're going to do X.
Right.
The other piece of information that I'll share with you is you probably are aware that at the university, most of us are suspending on-site activities after the Thanksgiving break and going to a full online remote learning process, so that the students don't recongregate after yet another long weekend that you mentioned. We are concerned about Labor Day. I'm always concerned about Halloween, because you know what happens in the city of Kent for Halloween. But we're also concerned about Thanksgiving. So there are all these triggering events that we're planning at the university to be able to pull away from face-to-face learning in a building, in a classroom, or the whole campus if necessary, based on what we're learning from Joan and from Angela and from the University Health Services in terms of the numbers of tests we're able to do, numbers of cases that are being reported locally and in the surrounding counties, and the very things you've discussed. We're using those data points to help us plan a strategic triggering process to know when to close a classroom, close a building, bring in the decontamination team to sanitize the room so we can get it up and running as soon as possible and restart that learning process. And so those are the types of things that you might want to ask your board to brainstorm on and to help you come up with a plan of action. And please feel free. I mean, this is what we're here for. If you need the board or the health commissioner in particular to come alongside and help you with those strategies, please let us know. because that's basically what we do. And allow us to assist you in that process.
Because I think some of your interventions to not only mitigate or to put a lid on a potential brewing outbreak, to try to bring it back down and under control is going to seem like overreach, and parents are going to think you're going way too much in the opposite direction. So they might need to hear that up front. When we start to see cases, not if, but when we start to see cases, we're going to immediately try to rein things back in a very methodical approach that might seem like an overreach, but will help us quickly quell this and get it under control. Because you won't be able to do like little strategies. You might have to do, bigger, more severe ones. And so parents should be ready for that.
I think those are all really good points. And I'm thinking about your communication plan. I'm envisioning that you're going to have almost daily communication to your parents and families. Because I agree with the others that there's probably going to be more than one case per building. And maybe the plan needs to have an asterisk on it so that all the parents understand that there are so many other factors besides just Portage County's color level. Portage County's level might not change, but there might still be a very significant outbreak in Kent or in a building. So to make sure they understand that despite whatever model they're in, hybrid or, yeah, I guess hybrid is what they'll be in, a particular classroom still might be sent to online learning, or a particular grade level, or a particular building, and I don't know how we would certainly, as Chris said, be willing to help craft some of those communications. And even if you don't distribute them ahead of time, have them ready, because once it starts to happen, it could really be like it could snowball.
I think that was kind of my question as well, and I don't know if somebody else may be able to speak to this a little bit better, but using the color-coded system, and with consideration to the incubation period for COVID-19, I almost feel like using those colors the week before, you're already at least a week late for what some of the potential exposures could be, with the incubation period being, 2 to 14 days. If we're yellow on a Thursday, that doesn't mean within that last week that color is actually accurate, I guess, if that makes sense.
It's a very important point, Louise, and thanks for bringing it up. It's also the reason why we want to all look at what real numbers are. While the range is 2 to 14 days, the median is 5 days. And so to be able to say, we want to focus on that median because that's 80% of the bell curve is going to fall under 5 days. And that allows us to be a little bit more proactive in terms of looking at that incubation period. Yeah, but good point.
Okay, thank you.
On a call that I was on today, one of the requests was for the school to call in absences to the health department so that they would have some kind of heads up on trends. So I don't know, that's something to even think about too, I know usually we don't ask why is the student being called off, but if we knew numbers of people calling off, if there was a quick uptick, maybe we could look at, okay, are some of these people ill? And is this just the start of a bigger picture to come into focus?
Joan, that's a very good idea, especially if you're linking not names, but grades or buildings, so that causal association that this could be a related set of cases.
So I could maybe reach out to your nurse, I believe Stephanie Young, and just have that discussion with her, if that's okay with you, Superintendent Joseph. Okay.
Are there other questions for the superintendent?
Chris, I'm just wondering, one more question for George, and I think we've thrown a lot at him in this discussion, and I'm just wondering if he has any thoughts of things that we could start, that we may be helpful right at this point. I don't know if that would mean speaking to the board, Joan speaking with the board, or I don't know, because of course that would be up to George to decide. But George, has anything come into your mind at this point in time that there's some way our board and our resources could be helpful to you in the district?
Well, Pam, thank you. And yes. The one thing that I just can't wrap my head around, I've made it very clear in almost every communication to our parents that they really need to have the ability to check symptoms, and not so much checking fevers, I'm hearing, but symptomatic, they have to help us out by providing that check in the morning prior to them getting on the bus, prior to them standing at a bus stop, prior to them coming into the building. They need to provide us, they need to work with us and make sure that they don't send a sick child to school. And Rose left, but Rose, I was on the Portage Health District's school nurse and superintendent webinar just yesterday. And Rose was the one who said, parents don't have thermometers. And I'm thinking, okay, well, it doesn't have to be an electronic thermometer. Hopefully we don't have any mercury thermometers out there anymore. Joan's shaking her head. But again, thermometers aren't that expensive, and maybe we should make them available somehow. And I'm not talking the expensive head swipe at $365 a pop, nor the $65 infrared. I'm talking the normal in-your-mouth thermometer. Can we make them available for families? And should we as a school district be doing that?
And George, I'm wondering also, what about a checklist? Because think back to our discussion earlier in the meeting about what symptoms, we know what the big ones are, but are we confident that our parents know that? And since fever is not necessarily indicative, what are the other symptoms? So I'm wondering about whether we should be putting out to our families symptoms that each day they go with little check boxes. If Johnny has 3 of these, keep Johnny home. If Johnny has 1.
Pam, I'm going to interrupt you because Joan and I already did that. In fact, that was the one thing I asked her to respond to.
Thank you.
Because I made a couple just 3 changes, Joan.
No problem.
And if you agree, only if you agree. But yeah, we already have a checklist, but I also liked what the COVID, Joan, what was it?
It was the one that compared COVID, flu, allergies, and a cold, the common cold.
Yes.
So I thought that was a nice graphic, and
Yes.
I thought parents might appreciate that.
Yeah.
So Pam, we agree. We need a checklist, and hopefully we can finalize this and get it out to parents.
Anything else for the superintendent? Thank you, Superintendent. We really appreciate you joining us for the meeting and expressing your concerns and sharing your action plan. Again, let me offer our services if there's anything we can do to support you.
Thank you, Christopher. And once again, we are so lucky to have all of you available as a resource. And again, I already put Joan in my plan. I mean, parents know. That's probably why you're getting phone calls. But parents know that Joan's going to be helping us with these tough decisions.
Okay.
Thank you.
All right. You're very
Thank you,
welcome.
George.
We're going to go ahead and continue on with discussion at the university level. Joan, did you want to particularly mention something?
Well, it was just that we continue to meet every 2 weeks with the university, and their COVID planning team. They're continuing to look at what their most urgent needs are. And I think
Uh-oh. Can anyone else hear Joan? Not hear Joan?
No, Joan is frozen.
Michael, are you on there?
I'm still here.
Can you
Can you
see
hear
what
me?
happened with Joan?
everybody on my screen is frozen.
Okay. Mute your mic.
Okay.
And you could actually talk right now because you're unmuted.
Okay.
So hold on, give me 1 second. Right.
So, I'm not sure where I got cut off.
Whoops, she's
Can
gone.
you get it? Can you get it closer to her mic? We can barely hear her.
Problem that we're facing. There's many variables involved, but
Mike, we're not hearing Joan at all.
We could hear Joan when she wasn't trying to be heard, when she was on Mike's thing, but now we can't hear her at all.
Hold on, give me just 1 moment.
How about now?
Joan, can you say something? We're not hearing her.
How about now?
We're not hearing her. We hear you fine.
okay, so if I,
There she is.
Eat that.
okay. I am muted. I am muted.
You are muted. Okay, go ahead.
Okay. So now I've lost my train of thought.
So Mike, we got an echo and it's still very light. Can you just move your laptop closer to Joan?
Okay, how is that?
Still got an echo, but we can hear you.
Why don't you leave the meeting?
Should I leave the meeting? Okay, hopefully that will fix things.
That's better.
Okay, so with the university, I know that they too had questions about what would cause an outbreak. Would the Ohio Department of Health ever close us down if we had too many cases? What would that look like? So I know that there are those ongoing discussions. I think though that they are doing a lot of thoughtful and considered planning, but as I said, there's so many variables, and as much as you can plan, it's how the people respond. I think trying to, I hate to use the term, fold them into a plan where they're more of a teammate instead of having to be enforced might be a nice approach in terms of looking at some of the student needs, and even at the K through 12 level, the parent and student needs, to make them part of the team that's solving the problem with COVID instead of them being the problem and needing to be enforced into certain actions. On Wednesday, that'll be tomorrow, we'll be doing some canvassing and the kind of in the housing unit area that's not the big complexes, but are the individual homes that have been turned into student rentals, to try to explain the importance of keeping groups small, continuing to do social distancing, wearing masks, the importance of hand hygiene. What happens if the health department calls and tells you that you're a case or connected to a case? Because there is, I think, some concern from the student level in terms of why is this person from the health department calling me? I essentially feel fine, just the sniffles kind of thing. So there's, I think, a lot of education that needs to happen for people to come on board so that we can tackle this in the most successful way possible.
Yeah, and as a member of the COVID response planning committee at the university, I tell you, we can't thank Joan enough for all the insights and information that she provides every week with those meetings.
I mean, we still don't have triggers set, I think, at either of these levels, but I guess we have our 2 cases forming an outbreak that could be a start.
Well, I created a line in Julie's spreadsheet indicating triggers and thresholds. And I wanted to present that to you as soon as I get an opportunity to do so.
Perfect, thank you.
Yeah.
Okay.
Can I ask a question about the testing for the students, the Kent State students? I know that Kent State is going to be doing testing at the university, but is that going back to their home address, or is that going to contribute to our city's count?
Well, since they're living here in Kent, it will contribute to our city's count.
But what if they give their home address?
Well, they'll be working, if they're testing on campus, they'll be working through DeWeese, and they will be asking for their current address.
Okay.
And so the case goes to the jurisdiction where they're currently residing, not where their insurance is. So,
Okay.
yeah, that's a good question, but it will, I think, increase our case numbers.
It does cause a lot of confusion, though.
Yes.
So we have to be really diligent in reminding the students exactly what to tell the testing site when they go. The next item, Joan, is space for testing and vaccination clinic. I'm assuming you're referencing a pod type model.
Well, actually, the president of UH Portage Medical Center in Ravenna reached out to us and asked if we would be interested in like a timeshare space. He said it would be at a very reduced nominal price where we could either hold testing clinics or vaccine clinics. Right now, of course, we don't have the ability, we don't have the test kits, but I could request those from the state. I was thinking of some of our vulnerable populations that are maybe underserved and not tested. That might be a great way to address some of those needs, but then also in terms of vaccination, we're not an approved vaccine provider, but if we could have an MOU with someone, maybe we could get vaccine from them, and as a nurse, I could provide that vaccine under an order from perhaps Dr. DeJulius for, for underserved, or even for the city of Kent employees. I'm so concerned about flu vaccine this season. I really want to make flu vaccine as easily attainable as possible. And if that means me going to different departments and to their staff meetings, I'm more than willing to do that. So I was interested in Mr. Benoit's offer to us, if that's something we would want to entertain. So I don't have anything formalized now, but I did want to present that could be an option. I guess if the stars align.
Is he thinking Devon Place or at the hospital?
I think there are several different locations where he has different space, and I know he made the same offer to Portage County Health District as well.
Okay. So, I'm not speaking for the university, but knowing that we do not have fall sports now, I'm pretty sure that you'll have a lot of space at the Dick's Stadium as well as next door at the field house.
So I just, if we can make something happen, I think it would take too long to get the vaccine approval to be a provider. But again, I think we could move fairly quickly if we found somebody to partner with in terms of a memo of understanding that we would get our vaccine from them. They would store it for us. We would only take small portions that we would need to address whatever size group we were going to be vaccinating.
Again, I don't speak for the university, but you might call Julie and see if they can partner.
Yeah, I think that would be interesting. So yeah, I will do that. Thank you.
Joan, I think it's a good idea. I mean, I don't know what they would be charging us, but just to have the option of a clinical space, because it's set up right for privacy and, for administering shots or tests or whatever. I think it would be really helpful to have that space.
So
It's a good point, Angela.
I've told him that I would approach the board today. I just learned about this last Thursday or Friday. So I could write him back and say that we do have an interest, but we don't have a formalized plan, but that we're definitely interested in how we might be able to use that space.
Yeah, good idea.
Okay.
We're going to move on to action items. In your packet, you have the expenditures and encumbrances for June. Is there a motion to approve?
So moved.
Is there a second?
Second.
Thank you. Are there any questions about the expenditures as they're presented to you? Oh, who's this medical director that's getting a big chunk of change?
I know, don't spend it all at once, right?
Worth every penny of it and then some.
Absolutely, yeah.
No doubt.
I would like to say that I appreciate that she comes to almost every meeting. It's such a change.
Absolutely.
Thank you for that. Yeah,
Absolutely. Thank you.
happy to be here.
All right, there you have a motion on the table and a second, and there is no further discussion. All those in favor of the motion to approve the expenditures and encumbrances report for June, say aye.
Aye.
Opposed? Hearing none, the motion carries. The next item is the resolution for Kent City Council to adopt the HEAP resolution. Joan, can you just give us a top level summary of that?
Sure. So last week I went to council committee and we had provided them with an SBAR, a situation background assessments and recommendations letter that kind of outlined how a HEAP policy could be beneficial to the city in terms of a next step for addressing racism. I was very pleased. Without even one question, they unanimously adopted a resolution that I could bring then a formal resolution to enact a HEAP policy in the city. So that's what we have before us tonight. Then we had asked that the board approve this and kind of bless it before then I would take it to the actual city council meeting at their next meeting, which I believe is next Wednesday.
So as a resolution, Joan, help me remember, do we have to enact an emergency status in order to waive the 3 readings?
Yes, we would have to do it with an emergency.
So hearing that, is there a motion to recognize that this is an emergency situation for this resolution?
I motion that this is an emergency situation to recognize the HEAP and bring it to council next Wednesday.
Thanks, Michelle. Is there a second?
Second.
Thanks, Louise. You have a motion and a second on the table. Is there discussion on the motion? Hearing none, all in favor of declaration of emergency status for the resolution, say aye.
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 Opposed? Motion carries. So now we have a resolution in emergency status. Is there a motion to, Joan, do we need to read it first?
If you like, I can read it. It's fairly short.
If you wouldn't mind, please.
Okay, so this is resolution number 2020, and Amy Wilkins has to fill in the exact number that follows that, but it's a resolution adopting a health equity in all policies approach to public policy that intentionally considers the health impact of all proposed legislation and regulations prior to their implementation and declaring an emergency. Whereas the HEAP approach takes a broader view of what creates positive health outcomes, for example, zoning, transportation, housing, education, public safety, or environmental protection. And whereas racism has been declared a public health crisis by the Kent City Health Department Board of Health, acknowledging racism may be intentional or unintentional, is both systemic and institutional, and weakens our community instead of strengthening it. And whereas the social determinants of health, which are the conditions in which people are born, grow, live, work, and age, are impacted negatively by racism and racist practices. And whereas racism is a multifactorial problem requiring the combined efforts of many agencies and departments to address the injustices that have been entrenched for decades. And whereas the City of Kent is committed to actions to improve disparities, inequalities, and injustices in a thoughtful and methodical approach, a foundation of this work will be health equity in all policies policy. This will focus a lens on all legislation, ordinances, programs, and projects to look for and root out unintended consequences which could perpetuate or worsen disparities and correct them to equalize and improve principles and practices, allowing for greater health and well-being of all our community members. Now therefore be it resolved by the City Council of Kent, Portage County, Ohio, at least 3/4 of all members elected hereto concurring. Section 1, that health equity in all policies be adopted as set forth in the document entitled Standard Operating Procedures, Health Equity Policies Guidelines, attached hereto as Exhibit A and incorporated herein by reference. Section 2, that it is found and determined that all formal actions of this council concerning and relating to the adoption of this resolution were adopted in an open meeting of this council, and that all deliberations of this council and of any of its committees that resulted in such a formal action were in meetings open to the public in compliance with all legal requirements of Section 121.22 of the Ohio Revised Code. Section 3, that this resolution is hereby declared to be an emergency measure necessary for the immediate preservation of the public peace, health, safety, and welfare of the residents of this city, for which reason and other reasons manifest to this council, this resolution is hereby declared to be an emergency measure and shall take effect and be in force immediately after passage. And that concludes the resolution.
Thank you, Joan. So is there a motion for the Board of Health to support council adopting this motion?
So moved.
Thank you, Emily. Is there a second?
I second.
Thank you, Michelle. Is there further discussion on the motion? Hearing none, all in favor, aye.
Aye.
Opposed? Motion carries. Thank you, Joan, for bringing this up, and thank you, Emily, for your continued education of our board. All right, we're closing down now. We have one last action item, which is the HIPAA and data confidentiality policy. Joan, could you give us a quick summary?
You know, I think we might wanted to make sure that we had this information updated in policy, because we did hire 3 contact tracers from the sub-grant provided to us from Portage County. And so when we had them signing off on it, we thought, first of all, we better have it run through the board to make sure that it's still approved in their eyes. So I believe that Mike sent that out in a packet.
It was in
Sent out
this.
in this packet?
Mhm.
Okay, so hopefully you had a chance to look at that, because while they're working with HIPAA protected information, and certainly keeping that private and secure is foremost in terms of our contact tracers. So we want to make sure that we had those policies in place.
Are there questions to Joan before we ask for a motion?
So these aren't new policies. These are ones that we had in place.
So what are you asking the board to do then?
Well, it's been rewritten from my end to conform with what FAB is also asking us. So it has in it information regarding how the health department stores that information, what we're allowed to do with that information when they are contacted or when that information is collected.
I see. Okay. So essentially it's a revised policy.
Yeah,
Correct.
it's really an overhaul.
Yeah.
Okay. So is there a motion to approve the revised policy, notice of privacy practices?
So moved.
Thank you. Is there a second?
Second.
Thank you. Is there discussion on the motion for the approval? Hearing none, all in favor of the motion, say aye.
Aye.
Opposed? Motion carries. At this point, is there a motion for executive session? Hearing none, is there a motion for adjournment?
I just would add, for the good of the order, that again, we did hire the 3 contact tracers. We're in training currently. They're doing well. We had an outstanding pool of candidates to choose from. There was an extension of the Contact Tracer 2020 grant that Mike did a phenomenal job with to get submitted on Monday. So we hope to get that second portion of the grant that would actually more than double the amount, that we could hire an additional 3 individuals, or another 1.3 FTEs, hopefully, if we get approved for that. So that would definitely take a big burden off us. And if there were outbreaks in the schools, we would have that support to do the contact tracing. I just wanted to make sure that the board was aware of that. And that also, when Rose talked about their pop-up testing that happened at Neomed, that 6 of our staff in very short notice, in less than 6 hours, volunteered different hours on Saturday to go and help them staff that pop-up testing site because they were in dire need. So I really want to give a huge shout of appreciation to our staff because they just turned that around so quickly. And not only did they want the expertise of seeing that in action, but to help, to help a local health department and the community members who need that testing to happen.
Super. Please extend the board's commendation to the staff as a job well done.
Thank you. We will.
So Joan, are they already reaching out to people that they've been in contact with and infected?
Oh yeah, the contact tracers have been here and they've been assisting. So that's helped take a huge burden off me. I was doing 100% of those cases, and now there's 3 people as well as myself doing that job. So it's going to be a huge help, and especially now, a little bit of a lull. But I know those cases are going to be picking up, and they seem to be catching on very quickly.
It's great. Tell them welcome from the board.
Oh, absolutely. Thank you. I will.
Is there a motion for adjournment?
I move to adjourn.
Thank you, Michelle. What was that, Jack? A yawn second?
No, I don't know what it was.
That was my husband moving to adjourn, but I had it half muted.
All right, we'll take that as a second. All right, y'all, thank you so much for staying late and dealing with the business at hand. I just can't say again enough. Thank you, Joan, for all that you do. And
Yes.
Michael, your staff is just amazing, and we really so much appreciate all that you do for us.
Staff are really doing a phenomenal job. I could not do it without Mike, that's for sure, but everyone has been contributing. Yeah.
Super, job well done. Thank you. All right, all, you have a
Have a
safe
great
and
evening. Stay safe.
safe evening.
Stay safe, everybody.